I'm Terry Canale from Memphis, Tennessee, and I'm an orthopedic surgeon at the Campbell Clinic. Well, I was an old football player at the University of Virginia and was never really interested in anything but sports, and I took a abnormal psychology course that had some research in it, and I was fascinated with the research, so I decided to try to coordinate the research with my sports background, and that's how I ended up in orthopedics and sports medicine and pediatrics also. I think Dr. Campbell, Willis Campbell, who was head of the Campbell Clinic, was a pediatrician, and he became an orthopedic surgeon. And the first book that he wrote had to do with children's orthopedics, and it was a short textbook in the 30s, and then from that it expanded into all of orthopedics somewhere in the 30s, and that was the first textbook. And one of the driving forces in that was Dr. Hugh Smith from the Campbell Clinic also, but Dr. Campbell kept his name on it. We have completely redrawn every illustration in Campbell's. Formerly, we used to take pictures out of journals and ask for permission to reuse them. We've gone one step further now. Not only we have illustrations out of the journals and other media, but we've totally redrawn it where it's of one consistency, and you can tell it's from Campbell's operative. So we're very excited about that. We have an online version and a video version that we're very happy with, and you can actually read along and then get into a video of the procedure itself, which is very exciting for us.
My name is Daugherty. I've been at the Campbell Clinic 34 years. I've worked on as editor, editorial assistant in the beginning, and then editor for at least 5 editions of Campbell's Operative, beginning with those edited by Dr. Hoyt Crenshaw. We like to think that we have evolved by keeping current with techniques, with information, and at the same time retaining the one voice sort of thing. If you go to Campbell's, you know you are getting what the Campbell's doctors believe is the best information currently, the best techniques currently. We do try to not delete all the older procedures, because sometimes those are imperative for countries that don't have the technology. Well, I think Dr. Canale may have referred to it, but Jimmy Guyton, one of our total joint surgeons, has written an elegant new chapter on hip preserving surgery in young adults. There have been so many problems with total hip operations, hemis, all sorts of other things, and he has gathered together what we currently know as the best procedures for hip problems in young adults who might not be candidates for a total hip because they have a long lifespan left. It's interesting that I didn't realize the international impact of the book until my son moved to Japan, and he went to a Japanese orthopedic surgeon for a knee problem. At the time, his Japanese was not very fluent, so he took an interpreter, and through the interpreter he told the Japanese orthopedist, yes, I had surgery on this knee 10 years ago at the Campbell Clinic in Memphis. Well, that didn't even require interpretation. The Japanese orthopedist grabbed his Campbell's and said, who? So I thought, okay, maybe we do make a difference.